Welcome to Farming for Health, where Farmer Lee Jones and I talk with leaders in food, farming, and health and wellness to spread knowledge and inspire a plant forward future, starting now. Welcome to the Farming for Health podcast. I'm Dr. Amy Sapola, and today I have the pleasure of being joined by Erin Meyer. She is the founder and president of Basil's Harvest. Welcome, Erin.
Hello, and thank you for having me.
Yeah, thank you so much for being here. I'm really excited to learn more about you and Basil's Harvest. First, I'd love you to just start off by telling me about your journey and how you got started with Basil's Harvest.
Mm. Well, this is, I love this question because I feel like I've been working the last 30 to 35 years to bring me to where we are today in what we know today is Basil's Harvest, the nonprofit. And um, I am a dietitian and I have my master's in sustainable food systems. And I'm also a professionally trained chef. And my journey actually started, I'm going to say, as a certified diabetes educator in a hospital in Peoria, Illinois. It was an outpatient and inpatient program. And the thing that I loved about that is that I was working with people and I was listening to their stories about, who they are and what they like to eat, what they didn't like to eat, and really diving into the behavior of their lives. And what I learned early on is that I needed to know more about food. I wanted to know more about the different ways to prepare food, how to really engage in the taste and the varieties of food so I could engage with my clients. Um, so that started my journey in culinary school. My goal was to improve on what I knew and what I knew how to do so that I could be better served and I could better serve my clients. So I did that, and I worked in the diabetes center for about 10 years. Then I had an opportunity to come home to our 12-acre farm where our 5-year-old and our 2-year-old were, and then to stay home with them. And I learned in about 2 weeks that I couldn't go from full-time management diabetes educator to stay-at-home mom, that I needed to have something else. And I loved being outside and I loved getting my hands dirty. So my daughters and I started a for-profit food business called Basil's Harvest. And we started by making herbal infused vinegars and we sold them at the farmer's market. And I will say that life in marketing does really well when you have a 5-year-old and a 2-year-old. What I learned is that marketing went well for all the other vendors at the farmers market because they would leave our stand as soon as we got set up so they could go help everybody else. But
Aw.
but what started as a very small hobby with herbal infused vinegars turned into a business that focused on our backgrounds, our cultures of who we were. I'm Italian, my husband is German. So we started building our food around how we were raised. It also focused on the regional food sheds. So we were working with farmers, purchasing from farmers. We started this business in 2001, and by 2007, we had gone from being in my house at the kitchen making herbal infused vinegars to a church. Then we moved and we purchased a building and we were contracting with farmers in 2007. So we were servicing farmers markets and small grocery stores. In 2010, a tornado came through our home and or through our town and destroyed what we had, the building itself. And my kids, we had raised them to be independent thinkers and global citizens, and they were taking us on a new journey to the Chicagoland area, where they would go to high school, and start being who they saw themselves to be. And so I moved to Chicago with my husband and my girls, just north of Chicago. And I decided that I was going to go to grad school and get my master's in sustainable food systems. I had originally thought all along that I would get a master's in culinary nutrition, and I found that in 2010 that didn't exist. And so as I was searching different programs and talking to different culinary schools, I found food systems and I fell in love with it, and it really truly spoke to me. So I got my master's in sustainable food systems. I took a job as an executive director at a small nonprofit where they were bringing culinary professionals, chefs, and bakers to the farm to connect them to where their food was coming from, what they were ordering, and also introducing them to a regional food shed of small growers that they could get to know, and they could learn what this food system, this food shed really looked like. And so I joined that nonprofit, and we grew that into where we were bringing chefs and bakers from across the country to the farm, where they were really integrating themselves into a food systems approach, a marketing approach, really looking at what, this small group of growers could do and how that impacted the economic, the environmental, the social, and the cultural impacts, not only to the farms, but to the communities. And then we would take that and we would flip it, and we really focused on the chefs and the bakers, really helping them dig into what this meant to them, and how those four legs of sustainability impacted themselves as a professional and as an individual. The piece that was missing for me was health professionals. I always believed that as a health professional, whether you're a dietitian, nurse, social worker, physician, that we need to have our hands in the soil. We need to know where our food is actually coming from and what the impacts of how food is being grown today, those impacts is having on all of us, as a society, at the environmental impacts, the social impacts, and the economic impacts. And so I decided that I was going to leave that organization and start Basil's Harvest, the nonprofit, which we began in 2018. So that kind of brings us to where we are today. And I just want to, on a side note, basil is not the herb. It was my black lab.
Oh, cute.
Hmm.
I wondered how
Yeah.
you got the name.
Hmm.
Okay.
Yeah.
Very
Yeah.
cool.
So that's why I continue to carry it forward with me.
Yeah. Oh my gosh. I love
Hmm.
that. A message from our sponsor. Farming for Health is brought to you by Farmer Jones Farm at the Chef's Garden. Farmer Jones Farm provides nutritious, regeneratively grown vegetables to home cooks nationwide. If you are searching for vegetables grown in a way that's healthy for you and good for the planet, try a curated box from Farmer Jones Farm. Get 15% off your order with the code FarmingForHealth15. And so the mission for the nonprofit, can you talk a little bit about that and what you're hoping to accomplish now with Basil's
Sure.
Harvest, like version 2.0, the
Sure.
nonprofit?
Sure. I'd be happy to. Thank you.
Yeah.
So our mission, we're engaging the power of regenerative organic food systems to promote human and planetary well-being. And what we envision through this work is that we have a vibrant and equitable food system that's supporting diverse farming families, healthy soils, resilient ecosystems, and community health. And the way, and the way that we look at this is that we have two areas of intervention. One is that we want to build collaborative ecosystems for change. So we are conveners and facilitators. We work on the ground with folks along the value supply chain. We ourselves, we're not going to change the food system. We're not going to create a value supply chain, but we want to bring together others that are engaged in this work, and we can help support and have our hands in it to move it forward. Um, the other area to be able to do that, we believe that we need to empower new leadership through experiential learning. And that also begins with the research. I never saw Basil's Harvest as an organization that did research, but we're finding that the research is providing the data, evidence-based data to help us move forward. So we've dipped our toes a little bit into the research. Um, and that really means that we're partnering with professionals around the areas of food system, soil health to human health, um, to help move some of that research forward. The way that, with this work, our outcomes that we hope to see is that there's more regenerative acres being transitioned, that institutions are purchasing these products, that leaders across this system recognize environmental nutrition. So as we look at the food system, we're really talking about the impacts of environmental nutrition, that we're developing new market pathways, and that all of this that we're learning and that what we're involved in, that we're helping to support the policy to advance these systems.
Oh my gosh, there's so much there, and what an
I
amazing,
know. I
what an
know.
amazing mission. And that's, I think, one of the things I wanted to dive into was, what does a regenerative food system look like?
Mm,
And why is that important to community health?
it's a really good question. And on a side note, just a real side note,
Yeah.
in December, I had the opportunity to speak at the Big Soil event. It's Dr. Liz Haney.
Oh, yeah.
Yeah, she invited me to talk about the work that we do. And what I loved, it was such an amazing event. And I got to meet a scientist, Jerry Hatfield, who worked with the USDA. And he asked me, his first question to me was, what does regenerative agriculture mean to you? And I said, I don't look at it as regenerative agriculture. I look at it as a regenerative food shed. And the reason
Oh.
that I believe that is that we need to be looking at four legs of sustainability: environmental, social, economic, and cultural. And if we're not looking at those things from a food shed perspective, from how we're growing the food or how we're tending to the soil, how we're growing food, how we're processing that food, how we're distributing that food, where it's going, and how people are using that food, if we don't look at each of those sections, we're failing.
Mm.
And we're failing because right now the system is not set up in a regional food shed system. It's set up in an industrial system. And if we follow that same pathway of the thought process of an industrial system, we're not we are going to fail, and we are not going to create the change that's needed to support regional farmers that are growing food for us to eat, growing food for animals to eat, how that food is being processed and who's processing it, how it's being delivered, so shortening the value chain. So we're encompassing this a region, and if we can create that model and move it to another region, then we're creating resiliency, in my opinion, for people, communities, and health.
Mm.
And it's going to take lots of people to do this work.
Yeah. Oh, absolutely. And so, when it comes to regenerative food system, how does that play into
Mhm.
that definition of regenerative farming and kind of
Mm,
the regenerative system?
sure. So, um, this is, I just want to say, this is the truth that I know.
Yeah.
When I think about regenerative agriculture, and I've always been a proponent of organic agriculture. When we lived on 12 acres and we were farming, we had hoop houses and we had some animals, and everything that we did, we weren't certified organic, but everything we did was around those principles. And And, when you think about regenerative agriculture, we need to go back in time, right? We need to go back to indigenous peoples and how they worked with nature and how um, variety and how important it was to have variety. And so if we bring that forward and we look at a regenerative system, not only is it cover crops and rotation, um, it's also listening to nature and being guided by nature. And I want to say I'm not a farmer, and that and I work with farmers, and I respect the daylights out of farmers, because their job is so complex. Um, but if we look at those things in the farms that we are working with and that we have relationship with the farmers that we know, trying to figure this out every day. There's not one way to do it, I guess, is my belief. And the knowledge that they bring to their land is so vital to listen to as decisions are being made. And as myself as a nonprofit, I have an idea, but I need to talk to the expert who's farming that land. So the regenerative system isn't only about the soil, it's about the people and the place that's involved with that.
Mm, I love that. And how does that impact human health ultimately? Like
Mm,
how does that system change affect
mm.
health?
Wow. I don't want to say that's a loaded question, but man, that's a big question.
I know. Yes.
Um, I think if we can break it down into, I think if we look at the four legs of sustainability, sometimes that's the easiest way for me to wrap my head around this. If we look at the environmental impacts of regenerative systems and human health, we can start with soil and we can start with water, the two places at the very beginning, right? And by regenerative agriculture and that way of farming with cover crops and rotations, from what the research that I've read and the farmers that I've talked to and the agronomists that I've worked with, by building that soil health, farmers are reducing the amount of chemical that they have to put on the ground on the plants. So by doing that, you're reducing the amount of chemicals that are going into the water system or the watershed. Um, so by reducing that, we know that asthma has been connected to herbicides and pesticides, right?
Mhm.
So by reducing that, we know that there are pieces that connect, and the hope is that it has the opportunity to improve some of these health outcomes. Um, what we're farming, I live in Illinois, so we're predominantly corn and soybeans, and the corn is going to ethanol. It's going for to feedlots. Um, if some of the farms I work with a farmer who is certified organic and he's a grain farmer and a corn farmer, but he has multiple varieties of grains and of corn. And so by increasing the number of varieties is very important not only for soil and the end product, but it's also important to us as human beings because we need more variety in our system and in terms of our immune system and our microbiome. By limiting the diversity in our diet, we are causing potential issues within our own human ecosystem. So increasing diversity of food becomes very important. Um, what else? What other questions? I know that there's
Yeah.
more. if
No, I think that's a great way to say it is that diversity in our food supply adds to food security, first of all, but
hmm
also the
hmm
diversity in your diet really helps to support your health, as in,
hmm
with more diversity,
yeah,
you're covering your bases more or less
hmm
on the
yeah.
basic needs for human health.
hmm
Um,
Well, and you bring up a really good point about food access. And so if we look at
mm-hmm.
the economic side of things, by working to create a resilient food shed, um, food banks are working in this area in Illinois around farm to food bank. They are trying to figure out how they can work with farms to bring in fresh products so that there is fresh food for everybody. Um, I worked with a food bank, just provided support. She had some questions about how to even begin this. And we started talking to a few farmers, and she ended up contracting with, I think, two farmers to grow specifically for the food bank.
Wow.
And the group, and this was a large group, we created a healthy food policy. And food banks, what I've learned is that food banks, they get a lot of donations, and sometimes the donations aren't the healthiest of foods. And this
That's
food
so
bank was
spot
making
on.
it a priority to figure out and to focus on bringing in fresh produce and to work with the community on from a culturally appropriate um, need to provide foods that are being asked for,
Mm-hmm.
you know. And so there's just wonderful work being done all across the country in these aspects.
Yes. Oh my gosh, that's one of my favorite soapboxes to stand on. Is oftentimes I see food shelves as perceived to be a dumping ground for unhealthy food or food that you don't like or want or whatever, and the old saying, like, a calorie is a calorie. People just need calories, is what I used to be told at our food shelf that I was on the board of. And I couldn't disagree more. And I think that there is an ethical responsibility to provide nourishing food to everyone. And I appreciate your take to bring in like those fresh foods and to work with farmers, because I think that's just fundamental to human health.
hmm Oh, I agree with you. And the other piece that I think is really important to this is that, you know, everything that we're talking about within systems change, I think it's very important to keep it as simple as possible. And if the one thing that we take from this is that food has to be delicious. And
Mm.
if food isn't delicious, you're not going to, the system isn't going to change. And we work with a college of medicine. We have a culinary medicine program. And part of that program, we do, it's a 3-year program. We teach quarterly. So we have 12 classes, but every fourth class is based on food access. And so we highlight a different piece of food access. And a lot of times we don't think about this, but if we consider that food needs to be delicious and it should be delicious, we have that right, that we also need to talk about how do we season food?
Mm.
How do we're talking about budgeting, and we're talking about food pantries, how do we emphasize not only the food itself and the recipes, but providing a spice mix or herbs or, within, helping with budgetary guidance. How do we help support and provide um, information on, maybe, in your budget, you can purchase a dried herb or a dried spice. And so to help incorporate this, so you're starting to build your pantry. I think I just went down a rabbit hole. I apologize.
No,
But
I totally agree with you. And that's, I worked with students. I was telling you this beforehand, but I worked with students and I made them make recipes based on
Mhm.
what was available at the food share. And that really shined a light on for us on what sort of staples don't we have. Like if you can't even make a
Mhm.
recipe, a basic recipe with what we have on the shelves, we've got a
Mhm.
problem. And so
Mhm.
by kind of forcing that issue that like, okay, what recipes can we make with what we have in our building,
Mhm.
that definitely was
Mhm.
enlightening to us, I think.
Yeah. Well, and I think it goes back to talking about resiliency and farmers in the region. If we've identified what the foods are that people want, so with this food bank, one of the foods that came up was a specific pepper that the Latinx community uses.
Mm-hmm.
And so they contracted with the farmers to grow this pepper so it would be available. And so then this provides the next conversation of how does it need to be processed and building that infrastructure, or should that infrastructure be built? So I think it's important to remember to think from a systems approach, not we're just going to grow this pepper and we'll have it. It's okay if we grow it, what do we do with it? How should
Mm-hmm.
it be processed, or should it be processed? But the opportunities within the food shed of creating potential jobs, potential
Mm-hmm.
infrastructure to support the food shed becomes really enlightening, and I think is really important.
Yeah. Oh, absolutely. A note from our sponsor.
The Chef's Garden is a family owned regenerative farm that grows the most flavorful and nutritious vegetables, herbs, and microgreens for culinary professionals and home cooks. For over 30 years, the Chef's Garden has supplied some of the world's finest chefs and restaurants. Now, through Farmer Jones Farm, the same delicious ingredients are available to home cooks in the United States to use and enjoy, delivered directly to their homes. The Chef's Garden mission is to grow exceptional vegetables, care for each other and the land, and inspire a vegetable forward future. For more information, visit chefs-garden.com.
So, as far as resiliency in our food system goes, can you talk about that? And then, what do you see as the most pressing issues about resiliency
Oh boy.
currently? And what are you
Mm.
most hopeful about?
So resiliency. Um, the area that we work in where I can connect to resiliency is, we've identified that there are silos between food, farm, and health. That, how the farming, they're farming and it's not connecting to necessarily the food, the processing, um, and then that isn't connecting to our human health, just for example. And
Mm-hmm.
so when we talk about resiliency, and this is, I do want to interject and say, this is where we're working. There are so many places that need to be addressed within building resiliency, that no matter where you are within the value supply chain or within the food system work that you do, is picking a spot and working in that spot. And so we, our tagline is rooted in food, farm, and health. And one of the initiatives, that programs that we have, it's called CRAFT, Coalition of Regenerative Ag, Food, and Health Professionals. And this group came together. It's a group of physicians, dietitians, chefs, researchers, climate, water, soil, gastroenterology. Let's see if I'm missing anybody. I think that covers everybody. And what we identified is that there are silos between farm professionals, food professionals, and health professionals, and we need to bridge those silos. And so when you talk about resiliency, what I can speak to in that program that we have is that we are trying to build bridges around these these three areas to bring these professionals together to say, identify what is the problem that we see and how do we move that forward. And so with this group, the first thing that we identified was we need to know what the data says. What does the literature say around regenerative agriculture and human health, or soil health and human health? And we know based on the data that they don't connect. The words are very similar. The verbiage is very similar. We believe, we hypothesize, and we believe that they connect. But we went into the literature to learn what's there, what isn't there, to help guide us on our path forward. And so with that, information that we've gleaned, what we've learned, we're writing a peer-reviewed journal article that we hope to get into a medical journal so that we can start having this discussion and promote this discussion amongst health professionals to start to bridge that silo of agriculture, food, and health. It also is driving a survey that we're targeting to health professionals around regenerative agriculture, soil health, human health, and the microbiome to learn what do you believe, what do you know, what don't you know, are you interested, what are you interested in, to help guide our next steps in education and outreach. So for us, resiliency is first learning what's out there, learning what the evidence states, and then from the evidence saying, okay, these are our next steps, because ideally what we want to do is provide education and outreach that is connecting regenerative agriculture, regenerative food systems to human health. So that's how we're working in that area.
Oh, that's fascinating. That's a great answer. Yeah. And I think that's the study component of that, and to kind of glean what the community knows and doesn't know is a really great place to start. Our podcast is called Farming for Health. And when you hear that, farming for health, what does farming for health mean to you?
I'm going to go back to the 4 legs of sustainability. From an environmental health capacity, it means rebuilding our soil, bringing back the diversity of plants and animals, and food and fauna. It's clean water. It's being a place where not only my children, not only their children, but their children, and we're doing this for future generations. So it's the health of our ecosystem. From an economic perspective, health means to me that the work that everybody is doing in this space is helping to rebuild rural communities that have been decimated. From a social impact area, I think about community health. And we haven't really talked about that in general, but we know that the majority of diseases that we have today are food related. And that is just, we just have to find ways to support behavior change and access to where we can move the needle on the amount that these diseases are impacting people. From a cultural perspective, we need to grow food that aligns with the different cultures. And created a program in our culinary medicine program, and we introduced regenerative agriculture to the residents in this program. And when we were talking about regenerative agriculture and we were talking about the microbiome, we really were focusing on the Mediterranean diet. And what hit us immensely when we were designing this is that, yes, it is the Mediterranean diet, but we need to change the paradigm in the sense that every culture has a Mediterranean diet, and we need to start talking like that. We need to figure out, how do we change the framework of this? Yes, it is the Mediterranean diet, but every culture has their own diet that represents a healthy lifestyle, which
Mm-hmm.
is for that area of the world a Mediterranean diet. But in
Right.
other area parts of the world, the ingredients and the foodstuffs are different, but they're just as, or if not healthier, than the foods that we think of in a Mediterranean diet. So we need to lift that up. So that's
Yeah.
what I think of when I think about farming and health.
What a great answer. So, what vegetable forward meal are you most excited about
Mm.
right now?
Gosh, that's okay. Um, that's a really good question. It's springtime is here, right?
Mm-hmm.
And asparagus is going to be coming up. Mushrooms are going to be coming up. Um, and I am an avid mushroom hunter.
Oh,
And
fun.
so, yeah, it is fun. So when I think of asparagus and I think of spring onions and I think of morel mushrooms, I think of potentially a risotto, which I have to also clarify, being Italian, it must be where my family came from in Italy because I grew up with risotto. And when I heard risotto, I was like, what is risotto? But everybody else knows it as risotto. But I think of a spring risotto. I also think of fresh eggs with these mushrooms and with asparagus. So
Oh,
that's
that
what I
sounds
think of when I think
amazing.
about vegetables to, yeah.
Now I'm hungry. I think that
I
sounds
know,
great.
right? I know, right?
We're so excited for asparagus here. That's one of our favorite
Mm-hmm.
like signs of spring. So, yeah.
Mm-hmm. Yeah, and in terms of being a forager, there's a spot in my hometown where my dad taught me how to look for wild asparagus, and you don't see
Oh.
wild asparagus very much anymore because of all of this the chemical
Mm-hmm.
spraying that happens. But there is a spot in my hometown that I found wild asparagus, and I, it's the chase. I don't even have to find more than two stalks, and I feel like I'm successful. It's the
Yes.
chase, yeah.
That's
To
I used to live in Wisconsin, and we would drive around and look along the roadsides, and you'd see it, but you have to be careful because people will spray along the roadsides. But
yeah.
it was always like so exciting to
Hmm.
see it and like kind of mentally mark where they
Hmm.
are.
Exactly right. Yeah. But with
Yeah.
cell phones now, you can take pictures in the summer and fall when it has all the
Yes.
fronds. Yeah,
Yes.
yeah.
Oh, that's
And
so
go back
fun.
to it. Hmm.
Yes. Do you have any last thoughts for our audience today?
There's a lot of work to be done, and no matter where you are along the chain, pick a spot, talk to a colleague, talk to your cohorts, and see where you can insert yourself. You know, one of the things that I believe is that we as professionals have a certain reach with the work that we do, but we have to remember that we are also individuals. We may be a spouse, we may be a parent, we may be a fireman or a firewoman, we may belong to a church. Wherever we are, as a professional in the work we do, that's one finger. But if you add the other fingers and start talking and sharing, the impact can be stronger. And I just encourage everybody to think about that and to see where else they can share this information and their passion to create change.
Yeah. I think that's the key is go help where you're passionate, like wherever you get lit up and find something that you love, that's where I think people can have the most impact often, is doing what they are
Mm-hmm.
passionate about. So thank you so much for being a guest today. Where can our audience find you online, as well as Basil's Harvest?
So basilsharvest.org. And then also, I'm on LinkedIn. I had to find that address, but I am.
We
Whoops.
can link it up. That's fine.
I'm on LinkedIn. Basil's Harvest is on LinkedIn. Please go. We have some of our papers that have been written and follow along with the work that we're doing. So you can reach out on LinkedIn. You can email me at e.meyer, Meyer, at basilsharvest.org. I'd love to hear from you. And, we love working with people, and if we can help or support or answer a question, we would love to do it.
Awesome. Well, thank you so much again for being on the show today.
Well, thank you for having me. This has been so much fun.
Thank you for listening to Farming for Health. We hope that you enjoyed this episode. Connect with Farmer Lee Jones and I on Instagram and Facebook.